Many people are familiar with the transfer board. We should be calling it a transfer board, not a slide board, because we don't actually like your bottom sliding across this over and over, because again, puts you at risk for skin breakdown. So a transfer board, you should still be working on lifting while you're using it. There's a few key points that you need to learn. You should always have 2 points of the board on the surface you're going to, and 2 points of the board underneath your person. So I'm going to just move myself over onto the board right now. When you're doing the transfer, you need to have one hand on the board. If you start transferring without your hand on the board, you're just going to move the board. It's going to slide all over the place. So one hand goes on the board. Never wrap your fingers around it because you can pinch them. So hand on the board, other hand on a stable surface. You're going to work on lifting up, not sliding. Now I'm putting my other hand on the board, lifting up, not sliding, and I'm over. That's all you need to know. What we're going to do right now is actually practice the slide board transfer. I have a lovely volunteer here. Her name is Norma. She is very brave. She is still an inpatient here at Shadok Hospital, yet she volunteered to do this video with us. Now, Norma has had her spinal cord injury for just over 2 months, and she's graduated past the slide board, but she volunteered to be our demonstrator for this skill. So I'm going to have Norma do everything that she would normally do, and I'll help her as she needs it. And I'm going to also show you where you can have somebody spot you to make sure that you're not going to fall. Okay? So the first thing Norma's doing is getting her 1 foot off the footrest. She's moving herself forward. She's already got her chair lined up at a 30 to 45 degree angle. She's got her brakes on. She's nice in front of the tire. So, and her 1 foot is on the ground, and her other foot, it works best if she keeps it on the footrest. So that's what we're going to do. She's going to lift up, and I'm going to put the slide board. What you want is 2 points of the slide board on the cushion and 2 points on the surface that you're transferring to. So if I was worried about Norma falling, I'd have my hands right here. I get it nice and tight. But I know Norma's going to be fine, so I'm going to let her do her thing. Beautiful. Voila. So essentially she just used the slide board as a bridge to get her from one surface to another. So instead of putting it back under her, we're just going to do the transfer all the way back so you can see how that would happen. Perfect. Now Norma's just going to go back into the chair. You want to get as close to the chair as possible. And make sure 2 corners of the slide board are firmly on the cushion. I'm just going to adjust it a little bit, Norma. There you go. And she's in. Voila. Okay, what I'm going to show you is a towel transfer. I'm going to get this towel underneath the lovely Alyssa. The goal is to get the towel right underneath the bottom, actually. So it's going to be right underneath her butt, not here, not down her leg. It's going to be right underneath her butt. And I'm going to use this little towel to lift Alyssa and get her onto the bed. You ready? So the first thing you'll notice, we have her chair tilted a little bit back. That's so that I don't have to worry about her falling over. I'm going to lift her legs up and put the towel underneath. I'm going to leave the seatbelt on first. So you just want to get the towel back nice and far. Just going to pull out her knees to bring her bum further forward so it's easier for me to transfer. You ready? As I just do it. Alright. Now I'm going to get Alyssa to tilt her chair forward. I'm going to just put my hand on her shoulder, make sure she doesn't fall forward. You good? You got your balance? Turning the chair off. I'm just going to take her feet off the footrest, just so they're nice and solid on the floor. All right, now the key here to make this simpler is to get Alyssa to lean very far forward. She's actually going to rest her shoulder right on my hip. Okay. That lovely reminder. Okay, so we're going to get her forward. You okay?
Yeah.
So I'm resting her shoulder right on my hip. This arm okay? Can you get it forward? Okay. On the count of 3, we're going to transfer over. You ready? Yeah. 1, 2, 3. And then we're just going to sit her right back up. You okay? Good stuff. Okay. So now we're going to do the towel transfer from the bed back into the wheelchair. It's essentially the same transfer. This time, instead of having the chair tilted back to help Alyssa with her balance, we just have her laying back on a wedge. She could be on pillows if you're by yourself. This way I could lift her legs up, put the towel under just like I did in the chair. You want to make sure she's far enough forward so that you get a nice big lift, so she's fine there. And to get Alyssa sitting up, what I'm going to do is actually let her use her bicep muscles. They're very strong. I'm going to have her pull herself up with me, so I'm not straining my back or my arms. I'm just going to lean back and she's going to pull herself up. Are you ready? 1, 2, 3, pull. So that's all Alyssa. Let's make sure she's got her balance. Got it? Okay, so you're going to put your hands in the middle so they're out of the way. She's going to lean her head opposite direction to where we're going, so opposite to the other transfer. Put her shoulder right on my hip. Are you okay?
Yeah.
Okay, so on the count of 3, we're going to go over.
Okay.
You ready?
Yep.
1, 2, 3. And we'll take her out. You okay?
Mm-hmm.
I'm just going to straighten her hips out a little bit. Ready? 1, 2, 3. Here we go.